Beat me up about it, and I felt worse.
Wives do that.
Just trying to be a good host.
It's good.
Hey, John.
I'll take this off now that I'm the only person in the building.
M. Tally.
Yeehaw.
Who's M. Tally?
That's Chief
Mike Talley,
Mike.
chief of fire chief for.
Yeah.
Oh, Phil.
Yeah.
You have a flag for us, right, Stan? All right.
Tell me when you're ready.
Let's go ahead. Let's go ahead and start because I told Sheila that we were going to start around 1:10. So, if you will, pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I forgot something very important, which I bought just for our Zoom meetings.
The dinner bell.
First Flight Rotary Club will now come to order. Stan, would you please lead us with invocation?
Yeah. Bow your heads, please. God, give us the humility to accept where we are and to work with what we have and what's been given us so that we can serve above ourselves and contribute to the goodness in the world and not distract from it. Amen.
Amen. Thank you. All right. Well, Carl, you there? You must still be connecting. I have just right now one announcement, and that is that Carl is working on doing a project, trying to get us a service project really to help with the arts, music, robotics, and other extracurricular type activities for the school. If you're interested, he's having a meeting at noon on Friday. So if you haven't gotten an email from him, I think he just sent it to some of the board, contact Carl and he'll give you a link, and it's noon on Friday, and it's via Zoom. We are at some point gonna finalize our Oink and Rooster stuff. Like as I said before, really it's a success. One of those people that really made it a success is sitting in the middle of my screen, and that's John Polk. I don't know that we could have done it without John this year. So everybody give him a round of applause.
That was a group effort, guy, no doubt about it. Group effort completely all the way around.
Well, you opened up your house and you did a lot of the foot traffic day 2 before, so thanks.
Well, I enjoy doing it, and hopefully we can get more people on board next year once we get COVID behind us. It'll be great.
Well, I'm going to go ahead and tentatively put you down for next year's party, just because even though I didn't drink any on the trip, the party the night before, I still enjoyed that watermelon beer. So, hey Bobby, hey Kern,
Hey, Bobby.
How are y'all?
Great, guys. Nice to see everybody.
Does anybody else have any announcements? We just did the pledge, invocation, and for those of you who didn't jump on, Carl is having a Zoom meeting on Friday at noon. If you're interested, just trying to help promote the arts and extracurricular activities, robotics, that type of thing through the school. Kind of a service project, I think, mainly rub heads and figure out how we can help as a club. But if you didn't get a link and you're interested, email Carl, and he will give you all the information and work that you can agree to.
Yeah,
So,
the whole idea, Jay, is follows up on Karen's question to John Farley last week. Is
yeah,
what are these kids going to do, or what are we doing to help these kids keep up with their extracurriculars, if at all, during the COVID year? And because that's such an important part of their college applications, and frankly, their interest in school. And it's not so much sports, although that's not out of the realm, but it's mainly arts, STEM, all kinds of things that these kids do after school that keep them engaged in school. So that's kind of the discussion. We're trying to get Chuck Lansing, the principal, to also participate, but we haven't heard back from him yet.
yeah.
So the idea of Friday is just a discussion to see a few members would be interested in trying to do, whether it's art shows, robotic programs, who knows what, and then of course what the teachers might want to do, working through the principal.
And if I can just join in, I don't know if you saw the news or not, but First Light High School just shut down for
Yeah.
a day to have a deep cleaning. So I'm imagining there may be a lot of busy stress right now. I don't know if I'll be able to join or not.
Well, I think in my brother-in-law is a principal at a school that's probably the equivalent of First Flight, maybe even larger. Their county's got about 50,000 people, and they've been open from the beginning. And I think this is going to be, and I hope that parents bear with the school system. And sometimes being patient is a lot to ask in 2020, it seems like, but that it's going to be a regular thing. Kids are going to go home in blocks based on exposure, and so I hope that people and we're sending both of ours back, but we're certainly in the realization that there's going to probably be some quarantining.
Mhm.
Unless England, who's doing a clinical trial on a vaccine and actually infecting people with COVID, that's a first in human medicine for a while, at least on the books. So however you feel about that, that's interesting, and hopefully it'll help a vaccine come along quicker. Carl, were you at it's probably been a year, but I think it was during Rob's term as president. Were you there when Mike Diana came and visited and spoke to our club about the Mustang outreach that they teach kids music lessons?
I was there.
If that was, it didn't stick with me.
Yeah.
Other people were raising their hands or shitting on their heads. So.
Yeah, one of the things I think that I took from that, and I think is important, and that to think about when you're thinking about the arts, and he said, if you think about a sport, you teach a kid a sport and they learn it, like football. Well, you're not going to play football for your entire life, but you may play the guitar up to the day you die. And I think that's one of the things that is important about the arts, is besides the expression part of it, many of these things can do for life. And surfing, of course, right, Bobby? So anyway, but I think it's a great project, and I'm going to try to be there. Noon's kind of a tough time. It depends on the day. So.
You have a question, Karen?
Yes.
Yeah, go ahead.
On a different subject, but I just sent a few people, Jay, Rosemary, a list that I had created of recommended people that might possibly be a good invitation to speak. Is there somewhere we could put that to make it available to members to access?
What we used to do is we used to have it on the website, actually, just a list of potential speakers, and probably maybe somebody would help volunteer. Just call a few on that list and say, hey, are you still interested? I mean, there are some like Lorelei Costa who just spoke a couple of weeks ago. So obviously we're not going to ask her to come next week or next month to speak, but just to try to get an idea who's still interested, and then we'll see if we can get that on the website. You just see your text Carl sent out.
Well, actually, not all of those people have talked with us. It's more of a springboard of ideas that you could go. But and what I found is when I talk to people, I've had everybody be interested. I haven't had anybody not want to take the opportunities.
Yeah, we could certainly, I think, or I tell you what, why don't we just put it together, maybe clean that up a little bit and send it to the people that are coming up. Let's do that. So when somebody's coming up, say like if my date to speak is December 3rd, you would send it to me and say, just friendly reminder, you're due to speak on December 3rd. And if you don't already have an idea of what you would like to speak about, on the topic you want to speak, here's a list of people that would likely be interested in speaking to our club. So I think that would be a good idea. And that also kind of gives everybody about a month. I think about a month and a half to 2 months is a good heads up that you've got a speaker coming. Any further, and if you're me, you've got 8 trillion things going and you're going to forget it. But that way you can at least start to line up. You don't want to try to get it week of. Not that that doesn't happen, but it's ideal. If it's really ideal if we can get a speaker, know who they are so we can post it and get it out there that somebody's coming. So
That always helps meeting attendance. If
yeah,
a good speaker and an announcement.
So I still,
Carl has a question.
yeah, go ahead, Carl.
Assuming that we will pass on the repeal day party this year.
Yeah.
What about our 2 Christmas parties?
I think did you reached out to Melanie about that, right, Karen? Have you gotten a response or? You're muted.
That requires my memory to work. So I think she said she did want to, but there was no date put aside for it yet. I don't think that they did plan.
I would say the first, and
I have to contact Melanie this afternoon, and I'll try to get a date firm down.
Yeah. And we'll go ahead and reach out to Ghost Fleet and see if they want to, or see if they want to pass this year. Go ahead, Kearns.
Why don't we have a vaccine party when something comes out?
It's probably not a bad idea. I'm not opposed to, because we typically do those 1 week after the other, and that would be a skip week. So if everybody's in favor of that, I'm fine, and we'll just speak with her about doing something down the road. 2 to 3 months after a vaccine comes out. They're pushing this thing pretty hard, I'll be honest. I want to see it get out there. But Corona's a real deal, so they've already. Well, we are still waiting for our speaker, who is quite possibly one of the busiest people in our county right now. We are very fortunate to have her. But if y'all see me and I kind of go away for a little bit, and look like I'm looking at the ground or something. I'm just checking to make sure that she hasn't emailed me or anything. So. I don't see anything.
Hey, Jay. just to
Yes.
clarify, so you're not looking for a web page on the programs. You're just going to kind of do, it'd be more like an email update of who we've had recently and ideas out there.
Sure.
So is that what you're looking at? So we'll pass on the web page because it does take a lot to maintain that.
Okay. So how do you think you would be the best way again?
I think just working with Karen, she and I'll, instead of me doing a web page, I'll just kind of take her ideas and have a group of recent speakers, say for the past year or so,
Yeah.
the other columns ideas, and I'll work with her to keep that up, email that out occasionally in lieu of doing a website thing.
Yeah. Sounds good to me. And we're sending out a Zoom link anyway, so I think that could be the.
Get a paper towel, wipe that up.
The speaker is supposed to be specialist on COVID.
Well, that's incredible.
Can you mute
Oh,
it?
county guy.
I got it. All right, hang tight. I'm gonna look and see. Oh, there she is. All right. Hello, how are you?
I can. So
Yeah, I've got you. Well, folks, I don't know that Sheila Davies needs a whole lot of introduction in 2020. If you didn't live in Kill Devil Hills in 2019, early on, you may need an introduction, but she has certainly been a very busy and integral part of our community for a while, serving as the mayor of Kill Devil Hills for, how many years did you serve? 8?
8 years.
That's what I thought. And then stepping up in the Department of Health and Human Services to be our director. And certainly we could not have asked for a better one. I'd like to welcome Sheila Davies, and she's gonna talk to us about coronavirus. I'm going to mute everyone. So if you want to just give me a second, I will figure it out. Go ahead and start, Sheila.
Okay, absolutely. Well, first off, thank you for your kind words, Jay, and also thank you all for the opportunity to be with you during your Rotary meeting today. Sorry, it was a couple minutes getting online, a couple minutes late. Certainly these are, I mean, it just is kind of cliche to say these are crazy times or these are unprecedented times, but they are. That's the reality. I'm actually in the Emergency Operations Center with my laptop up. Behind me is the 911 dispatchers, and on the other side of me is our big work group support room. This is not my normal office, but unfortunately it has been my office for the past 8 months during the pandemic when we first started our pandemic response and opened up the COVID-19 call center for Dare County and started our emergency operations. What I figured I would do today is just kind of give you some high-level details on some different topics associated with COVID-19 and then really kind of let you all drive the agenda based on questions that you may have for me. This could probably be a 2 to 3 hour presentation or talk if we were going to cover everything, or maybe a 2 to 3 day presentation. But so I'm going to give you some high level just information and then welcome any questions that you have. If I have an answer, I'll share that. And if not, then certainly I can follow up and get you more information. So I figured I'd start with our current picture of COVID-19 in Dare County specifically. And I hate to say it, but over the past about 10 days, we've been moving in the wrong direction with our case numbers. If you followed yesterday's update, you probably saw that we had our highest number of positive cases, which was 42. And that was our highest number back since, I guess, kind of like mid-July. And we've had a couple of days lately, yesterday being one of them, and a few days prior, where we've had 13 cases in one day, and it really takes us back to, the level of work that we were doing with contact tracing back in late June and early July. One thing, unfortunately, also we're seeing with our cases, not only are they increasing, but the number of direct contacts that are associated with each case are dramatically increasing. And, that's in part because people are getting back into more activities with others, and that's to be expected. And while I don't want to be all doom and gloom because, I don't like seeing cases go in the wrong direction, but I do need to say that when you look at the number of people we've had in Dare County over the duration of the summer and that continue to be here, our occupancy numbers are still really high for this time of year. Dare County is in a really good position. Overall, comparatively speaking to other coastal communities, we've done really well with our COVID case counts and numbers. And that's in large part to people doing the right thing. Certainly, there are people that are not doing the right thing, but as a community and people being informed and knowing what they should do and what they shouldn't do, Dare County has done well. I also think we're fortunate that we have an extraordinary relationship between public health, social services, and our medical providers in Dare County. And so we are in daily, sometimes multiple times a day, communication with one another. We're able to get results back quicker because of that relationship versus having to wait for those results to route back from a lab to the state and then the state back to public health. We get our test results, positive test results back directly from our local providers, sometimes saving about 2 days with that communication, which means we're able to ensure the positive individual is isolating quicker as well as identify direct contacts quicker and reduce the spread from those potential spread from those direct contacts. So all of those things have really helped Dare County keep our numbers, again, lower than some of our coastal communities. So the of our count case, of our current count case, so since we started counting cases back in March, we're at 656 cases total since March. 371 of those cases are residents and 285 of those are non-residents. For anyone of you that may be monitoring the website really closely, you'll notice that I gave you numbers that aren't yet on the website. So this is hot off the press. We've had 6 new cases so far this morning. So those figures are including our new cases so far from today. 36 of those cases are active among residents of Dare County. And unfortunately, we have 2 individuals who are hospitalized. One has been in the hospital a very long time due to COVID complications, and the other individual was just hospitalized yesterday. So the predominant way we're seeing transmission currently is still through direct contact. The majority of cases that we see and that we're receiving, we're able to trace that they acquired the virus by direct contact with someone who was positive. Most of the time, the person doesn't know that they were positive before when they were having that direct contact. So they weren't knowingly spreading the virus. They just didn't know. It was during that initial incubation period where either they were asymptomatic or had not been identified as an exposure. We are seeing a slight increase in community transmission, meaning we're not able to pinpoint where the individual acquired the virus. And that is something we are really closely monitoring as you know, if that number starts to creep up really high, which we hope it won't, but that's where, you know, we just really will have to impress upon people the importance of, if they have started venturing out and engaging in more activities, they may need to back down their activity level because of the presence of the virus in the community. So a little bit about kind of our COVID response and how things have evolved over time. So if you date back to when you first started hearing about the potential threat of COVID, really back in March, and Dare County's response, the picture back then was really difficult from the perspective of getting prepared and ramping up to handle what we've been handling over the past 8 months. You may recall back then there was a dramatic shortage in personal protective equipment. We were having to really ration personal protective equipment. And so some of the early decisions that were made by our local elected officials to help insulate Dare County was to give the time necessary to be prepared for this type of pandemic response. Some of that related certainly to the supply and demand and getting more PPE. I'm fortunate to report now we do not have any of those concerns. We're able to adequately provide the medical community. They're able to get access to the equipment that they need in the volumes that they need it. The testing availability has dramatically improved. Now, testing is widely available in Dare County, and results are, they come back very quickly. In the initial stages of kind of the pandemic onset, testing was reserved for a very specific population, you may recall, and it was difficult to get a test. And that was in part because of the reagent, the testing reagent availability. Again, PPE was linked to that. And also the ability for the labs to process the number of specimens that were being submitted. And the labs that do process those tests have dramatically improved their throughput and their ability to process large volumes of testing. So now, if you go to one of the urgent care centers, you're likely to get your results back within 24 hours. Sometimes it drifts into 48 hours. And occasionally, if you test like on a Saturday afternoon, because the couriers don't always run on the same schedule on Sundays, it may take into Monday afternoon or Tuesday to get your result. But if you're testing at one of the urgent care centers Monday through Friday, even into Saturday morning, we're getting those results back within 24 hours, which is wonderful. All of the testing that's done in Dare County right now relies on the PCR test as compared to an antigen test. And the antigen test, while you can get results back even quicker, there's still concerns with that particular test on the sensitivity and specificity of that test. So our healthcare providers are still relying on the PCR test, which is a much more reliable test. And so just food for thought on that one. The other thing that's evolved over time is the contact tracing. We do all of the contact tracing for any positive case, whether it's a resident case or a non-resident case, for that test that occurs in Dare County, or if the test occurs outside of Dare County, but it's a Dare County resident, we do contact tracing for all of those cases. We have made over 10,000 phone calls related to contact tracing since this started, and over 6,000 phone calls to individuals who have tested positive. Because if you have a positive test result, we call you every day to check in on you during your entire period of quarantine, which is a minimum of 10 days, but it can extend longer than that if you're experiencing symptoms beyond the initial 10 days. But when we first started the response back in March, even though a number of our staff members, we go through pandemic training every year and we're prepared, we know what contact tracing is, we've done it before with Ebola in much smaller numbers here in Dare County. It took us some time to get our staff, more staff trained and prepared, and then our systems in place. The state did not at the time have a data management system to track all of the contacts and their contacts and the dates of how long they needed to be in quarantine, when should they go get tested. And so we had to develop that ourselves. And then about 2 months ago, the state unveiled a new system, but we have decided to retain our own system since everybody's trained on it. We, at that point, had been doing it for 6 months. We have about, at this point, over 40 employees that are trained to do the contact tracing. We rely primarily about a core team of about 25 that are involved, but we have the extra to support to provide relief to staff during vacations or time off. And this is a 7-day-a-week job. We work on the weekends, not only with case identification and calling positives, but when we get a positive over the weekend, we need to contact those direct contacts as soon as possible. So that's occurring 7 days a week. A key component to the pandemic response in Dare County has been communication and will remain that way. And while we are doing a lot of work in that area, we know there's always opportunity for improvement. Dare County, we do have a very robust website with lots of information, almost to the point probably that it's too much information because it's a little bit tricky to navigate, but that's been a phenomenal resource that we've been able to point people to. I mentioned we established early on, I think back on March 17th, the COVID-19 call center, which is staffed by our Health and Human Services Department staff. We operate that Monday through Friday from 8:30 a.m. to 5 p.m. to answer anyone's COVID-related questions. A lot of the questions we get are related to testing. Sometimes it's folks that are concerned they've heard so-and-so's positive and they want some guidance. Or it's questions where folks call in to voice a concern or a complaint for someone not following the executive order or the executive orders. When that occurs, we actually in public health do not have any enforcement authority over any of the information in the executive order. So whether it's a restaurant violating the number of individuals that can be in the restaurant or folks not wearing their masks, per the executive order, the local law enforcement has the ability to do enforcement. So we're in communication and share any of those complaints or concerns that we get. We share them with the appropriate municipality or sheriff's department if that's where they belong. So, and then we do bi-weekly updates in print that we put out through the media, and a weekly video as part of that communication. Looking ahead at where the pandemic goes and the response, we have been working the past month and a half on our vaccine plans. The state had to submit their vaccine plan to the federal government. Friday is when that was submitted, and then locally we all have to have our plans communicated with the state. So the how that's looking right now is we do believe that there will be a small number, not a small, but a limited number of doses available as early as possibly mid-November for high priority populations. Our healthcare providers will be in that first round of vaccine availability. Then it will move to long-term care facilities and then high-risk individuals, with the goal of by March having widespread availability of the COVID vaccine. There's a lot of work to be done between now and then with communication with the public on understanding what the vaccine is, how it works, how it's safe. We don't have all of that information yet. That's in the works, but the timeline is we could start seeing vaccine given to healthcare providers by this November. The health department has already been approved as a vaccination establishment, and that's in that initial round. So we would be the ones as part of the vaccination plan to facilitate getting those to healthcare providers. And then over time, that will expand to include physicians' offices, where you could get them at physicians' offices, and then also down the road, possibly pharmacies as well. The vaccine will be at no cost to anyone in the United States. And Right now, it's looking like it's going to take 2 doses, though, and those doses would be given either 21 or 28 days apart. So there's a lot of management that's going into that on tracking and ensuring that depending on which vaccine you get, whether you have to return 21 days from them to get your second dose or 28 days. So lots more coming on that. But just figured I'd put that out there and let you know that all that's in the works with a lot of planning and organization. And then the other thing really, I think big on the radar right now is schools returning in Dare County face-to-face learning for those who have opted to do face-to-face learning this coming Monday. And unfortunately, not only have we seen an increase in cases over the past 10 days or so, but we've also seen an increase in the number of 17 or under cases. And again, I attribute that to the interaction level. I mean, some of these cases are linked to a child's birthday party. Another one's, to a family gathering. And so we have already had to start working with the schools because some of those direct contacts to these positive cases mean that they will not be allowed to start school next week because they'll still be in their quarantine period. So we have established a pretty significant communication plan and tracking system with the schools using our school nurses. We are very fortunate in Dare County. We have a school nurse for each school. A lot of school districts have to share a school nurse among several schools. So our school nurses will be the local resource for the school administrators on tracking those students, who's allowed to return when, who's in isolation, who's in quarantine, who's connected to whom, all of those little webs that are really critically important for us to track and monitor to help keep the spread low of COVID-19. So I'm going to pause. That was a lot of information to hit you with, but really I'll take a break now and just, I guess, Dr. Taylor, if you want to open the mic, and I'm welcome to entertain any questions.
Yeah. So if you want to ask a question, please just raise your hand and I'll call on you. Karen, I saw you first. Go ahead and unmute yourself.
Thank you, Sheila. I think I can speak for everybody in saying the job that your department has done has been very impressive, and we appreciate all the information you shared on the website, making it really accessible for all of us. And I actually have a couple of friends who are teachers that asked me to ask a couple of questions, if that's okay.
Absolutely.
It would be there are 3 questions actually. One was the age range of 17 and under. Are these younger people, or are you allowed to say? Second, could you define what a cluster is? And third, how many clusters would there be before schools would close, and whose call would that be? Please. Thank you.
Okay. Sure. So as far as the age group, it's all over. Looking at when I did a presentation, it's about 2 weeks ago, maybe longer now, to the school board, and I actually went through and broke down the ages at that point. In every age group, literally birth, I think our youngest has been 6 months, all the way up to 18 had cases, except I think at that time there were no 6-year-old cases. It was just an anomaly. It wasn't that 6-year-olds have any immunity. Since then, we have had a 6-year-old. In fact, looking at the cases over the past, back since the 19th, we've had 2 15-year-olds, a 9-year-old, an 8-year-old, a 6-year-old, a 13-year-old, a 1-year-old. So, and I'll tell you, it's not, this isn't like, we publish the same categories that the state does on our website. And what we've had to try to do throughout this is provide information, but also make it manageable that we can keep up with. And so that's why we have not gone through, it's not trying to hide information, but to try to break down every different age group would just be a lot of extra work, especially since we're doing this every single day. Some counties wait and report data once a week. We made a commitment early on to any new case, we're going to get it up on a daily basis. So no, I don't mind sharing that information. it's not protected. As far as clusters, so depending on the environment you're speaking of, in a long-term care facility, that's considered as 2 or more cases that are epidemiologically linked. But in a school environment or a childcare environment or any other type of environment, it's 5 or more cases where you can draw that link epidemiologically. And then your last question about what's the magic number to where the school system would close or so on and so forth. So there is not a formula for that right now in North Carolina. We have consulted with the state, most health departments saying, hey, what's some guidance? Because our school systems have asked us for guidance. And there just isn't. They have not put that out in North Carolina. I did about a 2.5-hour workshop on Monday with all of our school administrators, so principals, assistant principals, the superintendent, and all of our school nurses. And we discussed this question, and my guidance to them is the same as when I've worked with a business. So we have never told a business that you have to close. But businesses you've seen and restaurants this summer have had to close. And they've done so most of the time because they can no longer staff appropriately, either because there's too many people that are in quarantine because they were in direct contact with a positive case, or their critical staff may have been sick. And so it really boiled down to a staffing issue more so than we're closing because there's this greater risk to the community by being open. And I think that ultimately is what could drive Dare County's decision if they had to close a particular school, is because of that staffing issue. So hopefully that doesn't happen, but I think that's what would be the driving factor on that.
All right, that's great. I think probably if the state were to drop back into some of the other phases too, would necessitate that, right, Sheila?
Sure. I know the governor is speaking today at 2. I don't have any indication that he is going to make any decisions like that. In fact, I honestly don't think you would see any dramatic change between now, just speaking bluntly, and the election on any type of changes in direction to activity level.
Yeah.
But certainly the governor could. He could put some type of mandate in place, or require schools to only operate under Plan B or C. Dare County Schools is opening on Monday for face-to-face instruction based on a change in the guidance where the states could open the state could open an elementary school under Plan A. Plan A allows all children back in the classroom 5 days a week, and you don't have to have this social distance in between students. Whereas our middle and high schools, according to the executive orders and the governor's plan, can only return basically in a hybrid model because they have to adhere to social distancing. So students are, half the alphabet is coming on Monday and Thursday, the other half is going to school on Tuesday and Friday, and Wednesday is a day off. It's a virtual learning day for everybody. Yeah. So that could change based on government structure. Or the other thing that could change too is the local school boards still have the autonomy to make decisions for their school districts on whether they're open or not open and under what plan.
Yeah. I've always just out of curiosity, when you guys could you explain the quarantine process? Because I actually, one of my neighbors was one of the cases that was hospitalized. Fortunately, he's well, but when you've got somebody, let's say they're sick, they're not going to be hospitalized. What process? Could you explain that process?
Sure. So, and I'll quickly draw a distinction. So if you are a positive case, you are considered to be in isolation. It's a separate
Okay.
order. It's an isolation order.
Yeah.
If you are a direct contact to a positive case, then you are under quarantine in a quarantine order.
Okay.
And the difference is it's an individual who is in isolation, meaning they're symptomatic or they have a COVID-19 diagnosis. They have to remain in isolation for a minimum of 10 days from the onset of symptoms, or if they happen to be an asymptomatic positive, it's a 10 days in isolation from the date of test, because you just have to have a date to start with.
Mm-hmm.
And then if you were symptomatic, that 10 days, you have to be 24 hours fever-free by day 10 to be released. So that's where some people, their isolation goes on days, and we've had some folks even weeks longer than that because their symptoms remain in place that long. So quarantine, and quarantine gets tricky, and a lot of people get really frustrated with us, though we're just following the guidance. It's not our decision, but with the quarantine period, because quarantine, if you are a direct contact, which means you have been 6 feet or less for 15 minutes or greater to a laboratory confirmed positive case, you are required to quarantine for 14 days from that last date of exposure with the positive case. And that's regardless of if you get a negative test. So I'm going to walk you through that one more time because it gets a little tricky. So if we identify that someone's a direct contact to a laboratory confirmed case, we figure out what date was their last date of exposure, and then you go 14 days from that date would be their last date of quarantine, meaning they could resume normal activities on day 15. We also tell an individual who's in quarantine to wait at least 6 days if they are asymptomatic and go get tested. Otherwise, if they rush right out the day they find out, and they were only exposed 2 days ago, there's a high likelihood that would be a false negative because the virus hasn't had enough time to grow to a level that would trip the positive test. So we provide guidance to wait at least 6 days to go get tested unless you develop symptoms prior to that. If you develop symptoms prior to that 6 day, we ask you to go ahead and get tested right away because you've now started having enough of a viral load to trigger a symptomatic response. What we hear frustration with and concerns the most is people go and get tested on day 6 or 7, and fortunately they get a negative test, and yay, I'm negative. I'm ready to go back to work, or I'm ready to go back and do whatever they were doing. And they get frustrated and we say, I'm sorry, we cannot release you from quarantine until day 14, or you finish day 14. And that is because the incubation period for this virus is 2 to 14 days. We have seen a large number of folks who tested negative on day 6 or 7, but by day 10 or 11 start developing symptoms and then subsequently test positive. And so that's why that 14-day quarantine period it's not negotiable. It's set by the CDC and reinforced by NCDHHS because of that incubation period.
All right. And you recommend those people when they're in isolation or quarantine, they're at their house, please do not leave or leave for essentials only?
Actually, no, don't even leave for essentials only.
People will come get.
That's where our social services department has come in and helped a lot of individuals through this. If you don't have a neighbor or friend who can drop groceries at the door or pick up your medications, we have sent our social workers or our aides to go help and do that. We've delivered countless numbers of groceries. And so, yeah, we've been able to help people because you should have, if you're in isolation or quarantine, isolation, you're not allowed to have any contact. And we even have, try to guide people to separate from your family. Can you live in another room? Can you use another bathroom? That kind of thing.
Okay. Any other questions anybody have?
Great presentation. Thank you.
Yeah. Excellent.
Thank
you so much. Thanks for taking time out of your busy day to speak to our club, Sheila.
Yeah,
Absolutely. Happy to do it. You guys take
And
care.
if there's anything
Thank
we
you.
can do to help, I know you guys are swamped, but just let me know.
Thank you. Appreciate it.
Thanks.
All right.
All right. Take care.
Thank you.
All right. Does anyone have anything, any announcements, things they would like to share with the club?
Oh, don't go across the Memorial Bridge.
That is correct. Stan said he spent 2 hours. That seems to be the going time because I had a client that took them 2 hours to get to me today. So that stay on the beach. Go ahead and unmute, Bobby. I can't hear you.
Is that all times of day? Susie's been in Virginia Beach taking care of her sick
I
mother.
think there was a wreck. Stan,
Okay.
Jay, it's right in front of our house,
Yeah.
neighborhood. No, Bobby. They get started around 7 o'clock in the morning or so, and they finish up around 4 o'clock, and they reopen both lanes. They've milled the first lane, and now they're milling the second lane. And as they're trying to pave as they mill. So, obviously this week, hopefully they'll be done with the incoming side. But guess what? Later this week and next week, it's all the outgoing side. It's going to be messed up and down Duck Road. It's a 2-week project. And, but yeah, if she comes back after 4 o'clock, she should be in a lot better shape than if she comes back at 3 o'clock.
Thank you.
Yeah, we
Nice seeing all you guys.
came across about 4:30 and had no problems yesterday.
oh, good. So I should take the 64 route to the hunt camp this weekend, Kearns?
It just depends on what time you drive it.
Get out early, you'll be fine, man.
Yeah, well, I'll get out when things end here. Well, with that, let's go ahead and end with a 4-way test of the things we think, say, and do. First, is it the truth? Second, is it fair to
Fair to all
all?
concerned.
Third, will it
Third,
build
will it
goodwill
build
and
goodwill
better
and
relationships? And fourth, will it be
Will be
beneficial to all?
beneficial to all concerned.
And adjourn with our motto, service above self.
Above self.
Thanks a lot, guys. Great to see y'all.
Yeah, good attendance.
Yeah, it was. And a good talk. Sheila, we're fortunate to have Sheila Davies.
Yeah, that was great.
Thanks, Jay.
She worked hard as our mayor in Killable Hills. So, all right. Take care, guys. We'll see
Good
y'all
setup,
in a
Karen.
week or on Friday if you attend
Friday,
Carl's.